Hello everyone, saludos a todos. My name is Rigo I, Jr. I go by Rigo for short. I am a certified PA practicing in primary care in South Central Los Angeles. Welcome to my channel. I'm the Chicano PA. Before I continue, PA stands for Physician Assistant, and we are currently in the name of transitioning over the title. So, through our governing body, the American Academy of Physician Associates, or the AAPA, we just want to let you know that, it is, you might hear PA, you might hear physician assistant, and then in the process you're hearing physician associates. Along with AAPA and the physician assistants for Latino health, I already messed up, physician associates for Latino health, the correct terminology for our profession in Spanish would be asociado médico. So to be clear, when you're talking to your patients, no soy doctor, no soy médico, but asociado médico. That is the correct terminology, and I think there was a little mix up during the last video, but mi nombre es Rigo, soy el asociado médico, and I'll be the one who will be taking care of you basically. I created this channel in the hopes where when someone looks up, when they Google or YouTube search, what a PA does, what a PA looks like, what a day in the life of a PA is, I want them to, find someone that looks like them, that sounds like them, probably has the same culture or background as them. Or even something simple as upbringings, like where you grew up, what foods you ate, just things in general, just commonalities. I didn't have that when I was applying to PA school, so I found it kind of hard, to find, that light at the end of the tunnel, in which that you have someone telling you or looking like you're like, okay, if they can do it, then I can do it as well. With this project that I'm gonna be starting, I was fortunate enough to meet a current PA student, Mario Navarro, and he's currently at UC Davis's PA program. So, and his channel is the Mexican PA. So you might, jump on over to his channel and also his Instagram, and we will, you will either see me on his channel or him on my channel. So again, that's the purpose of our video series, where we want to interview and show what the day in the life is of a PA student and a practicing PA. Okay, besides all that PA stuff, who am I besides a PA? So I was born in Bellflower, California, and was raised on the borders of North Long Beach, Compton, and Paramount. So literally border cities on all of them. I'm a first-generation college graduate with my master's, if not one of the very few in my whole generation who actually achieved, these honors. I'm a son of immigrant parents, and my parents were born in Mexico. So my dad's from Michoacan and my mom's from Guanajuato. But the cool thing about them is that they came over when they were really young, and they both grew up in LA County. Shout out to my mom, who was able to inspire me with the whole Chicano movement. She was raised in East LA, Boyle Heights area, so I'm very grateful for that as well. A little bit about my educational journey. I started off at community college. I actually went to two, so I was dual enrolled, and then I was able to successfully transfer over to Cal State Dominguez Hills in Carson, where I was able to get my Bachelor's of Arts. And then for PA school, a lot of my hours that I got, like patient care, I was a patient care assistant, which we call them PCAs, and it's basically like a CNA. I was in a hospital setting, so I was in ortho, neuro, trauma, and wound for 3.5 years overnights, and nights are crazy, so kudos to everyone working the night shift. It was during my time in the hospital where I met other practicing PAs who were also PCAs, and I learned so much about hospital medicine in a different title, of course, but I am grateful for it. And then during my last year as a PCA, I was trained as a monitor tech, so I fell in love with the little squiggles of the ECG, and so I appreciate all the people who are CNAs and whoever's doing their patient care hours. I know it's a little bit hard because, first off, I know they don't pay well, and sometimes the hours are not the best, but you are the essential person that they see, that a lot of patients see, in either in their worst times, that they're most frightened to know that you're doing a service. So again, like I told you, I was a community college graduate, and then I went to Cal State Dominguez Hills. I was not a science major or a science background at all, so I did have to go back to community college, and I actually went to almost, a lot of them in LA County, and I was able to get my classes, and I applied one cycle, and fortunately enough, I was able to get in on my first cycle applying to PA school. I did attend Cal State Monterey Bay for their inaugural cohort, and yes, that was pretty intense, being the guinea pigs and being the first ones to navigate, as well as the faculty was navigating us as well. I've been practicing for approximately 1 year now. I graduated last year in 2021, and I've been almost like in the same specialties. So in my first job, I was a multi-specialty PA, working in pediatrics, OBGYN, and internal medicine, or adult medicine. And as I transitioned over to my second job, I'm basically, primary care with emphasis in all of those. So it's kind of cool that, I see people from newborn all the way to either that newborn's parents, their grandparents, or even their great-grandparents. So, and it's kind of cool, being one of the only providers in my clinic who's bilingual. So I'm able to reach patients, but at the same time, that's also like a curse where you have to see more patients because they feel more comfortable as a Spanish-speaking provider. For a lot of these patients, I am their primary care provider, and I'll see them for their annual physicals and order their annual labs. I will see acute visits, anything from like a headache, low back pain, nausea, vomiting, the whole spiel, the whole shebang. So we see acute visits, of course. I will order imaging, I will order prescriptions, and if it's recommended, I will do a referral, to the appropriate specialty that needs to take care of them. But for all these orders or referrals that I do, I am the one who also follows up on it. I review the labs and then make appropriate treatment plans pending those labs. I do consult my colleagues if I have to. So I do work in a clinic where it's another PA and a nurse practitioner. And we also have like chiro, acupuncture, and I do have a collaborating or supervising physician, which I see probably once a month, but I can reach out to them via Teams messaging or like a text message or a phone call, which is also good. For my OBGYN patients, I do the whole works, either, from pap smears to Nexplanon insertion removals, IUD insertion removals, to complete OB care. So I could see them for their initial OB visit all the way to literally the day before, the day of, when they give life, and I will see them for their postpartum care. And by the time I see them come back, I probably have 2 patients now. So I have, the postpartum mother who will be followed up as an adult medicine, and also the baby who I receive for newborn visits, and then also just their well child checks. Just a disclaimer, I do not deliver the babies, unfortunately, but I do see them. So I will see them either they're 8 days old and then onward, like I said. Apart from all of this, I try to diversify the profession and attend, pre-PA conferences. I do club meetings. I try to mentor as much as possible, and I socialize with other PAs, pre-PAs, PA students. And whenever I have the chance, I try to do that because I was doing it when I was a PA student, and I have met awesome colleagues, awesome friends, mentors, and if you reach out to us, it's most likely that we probably know each other, so we can help out with anything that you may need. So closed mouths don't get fed. So if you do need like help or like an interview question or just a question regarding the school, reach out. We probably know somebody who can help you out with that question. On a lighter note, apart from this whole shebang, like Mario, I am also a dog dad. So I am a proud owner of a stubbornly beautiful English bulldog. Her name is Lilo. She's 5 years old, and she acts like she's a 5-year-old, but she's awesome, and she's been through it all, and she's living her best life right now at home. My favorite food in general would be chiles rellenos, especially when they have a little kick to them. That's when it's good. I am a baseball fan. I love baseball, the sport in general. So if you invite me to a game, whether it be any from California or any stadium, I'll be more than likely to say yes. Yeah, I go for the snacks, the good time, and a good game in general. With this channel, I do hope to be posting every 2 weeks with a new interview, again with an APP or one of the APP students. And you can hear a little bit about their story and, you know, their specialty and what makes them, you know, a little bit unique, and then also how you can relate that to yourself when it comes to you applying to school. Again, I don't want to be taking up too much of your time, but I wish you more than luck and hope to see you in 2 weeks again. Con mucho respeto, your Chicano PA.